Excellent. So we're going to move forward to lesson number 9, which is monitor your mouth. Self-examine your mouth because we're all aware of the different signs of COVID-19. There are new signs and symptoms that are added almost on a weekly basis. And anything that is different in your body, just pay attention to that. Be in tune with your body, how your body is communicating with you. There's a new oral manifestation of COVID in the form of oral lesions. And it almost looks like a rash. Sometimes it comes with a skin rash. Sometimes it doesn't. It's pretty new information. They're called enanthems, and they've been seen in patients with COVID-19. They're like small little spots, look like a rash on the mucous membranes. What are the mucous membranes? That's the inside of the cheek, the inside of the lip, the floor of the mouth, right underneath the tongue, and the soft palate. So take a look. Nowadays, with our great cameras, with great light, take a look. You can take photos, email them to us. If you have a concern, we'll be able to advise you. We're now thinking that this is the 4th key symptom of COVID-19. So self-examine and take a look. And in general, the mouth is kind of a dark area. We don't always look, but make a habit at least once or twice a week to take a look. Stick your tongue out to the mirror. Take a look at it, front, bottom, the inside, side to side. Now that patients are not seeing the dentist on a regular basis and not getting their teeth cleaned. A lot of our patients do, but many patients don't go to the dentist. Things can develop and things can be missed. This is a patient that had a small lesion on the tongue that turned out to be cancer. And it could be very easily diagnosed by a self-examination. A cancerous lesion looks like an ulcer, a wound that doesn't heal. Dear patient, it hasn't been easy to stay home, and it hasn't been easy to close our practice for all this time. But although we were closed, we started to plan our return. We envisioned a practice that is adapted to the current situation, a practice where you feel comfortable coming in and being treated in it, a practice that is corona safe. So we designed a workflow that addresses this, a workflow that is efficient in time and minimizes interactions and the number of people in the office. So how can we achieve that? Be efficient and practical and also deliver high-end treatment. Plus, make you feel how much we care about you. So here is how it goes. Your appointment will be scheduled over the phone, as always. We will be asking a few extra questions on the phone as part of our screening process. Thank you for your time answering them. You will get an appointment reminders to your email and phone as a text message. These would have a quick questionnaire that you will be answering. It's called the wellness form. We are doing this to ensure no patients with symptoms enter our office. We apply the same to the doctors and all team members in our practice. We also have a special protocol for handling mail and packages. These get disinfected before entering the practice. Now here's the first big difference. Don't just walk in. We will text you when we are ready for you. Then walk in. Make sure you wear a mask. Our office is a masked environment. If you don't have a mask, we'll provide one to you. We got you covered. In case you didn't fill out the wellness form, you'll fill it out there. It only takes a few seconds. By the way, we only allow scheduled patients to come in. We have a special protocol for all patients, which is the same as we are using for our staff. We will take your temperature, we'll ask you to sanitize your hands. You will see HEPA filters scattered around the office. These machines filter and remove all particles in the air, including the COVID virus. Then you're off to your treatment. We will ask you to pre-rinse before your treatment. This reduces the number of microorganisms in your mouth and minimizes contamination. Our treatment room has been prepared prior to your arrival to maximize the safety of your treatment. On top of that, we are using a special fogger that kills all viruses with a non-toxic solution. In our new protocols, we don't produce aerosols during a cleaning, and we will manually polish your teeth. As things evolve, we will keep you posted on the new protocols. If you are planned to have a procedure done, your check-in process will be the same. We will bring you to the treatment room, and besides the doctors and the assistants and the HEPA filter, you'll see another machine. This is a device that suctions all the aerosols and captures them. Look at it like a large vacuum cleaner for medical purposes. Our doctors and assistants will wear personal protective equipment, including a gown, a cap, a special mask, and a shield. It takes some time to put them on, but it's still us below. As much as we would want to, we will not be able to shake your hand. We are sorry. During the treatment, as always, we will focus on making sure you are comfortable. Medical offices tend to be cold, so make sure to bring a jacket or even a blanket. Feel free to use your phone or other devices to listen to music during your treatment. After getting post-operative instructions and some medications, you're set to go. Your follow-up appointment has already been scheduled and your payment has been processed. Thank you for entrusting us with your treatment. We appreciate your confidence. Speedy recovery. We got you covered.